Hi, everyone. Cecilia here from ISSIP. We have the ISSIP Ambassador here today. Marietta Baba is joining us. Hi, Marietta. Thanks for joining
Hi.
us.
Hi, Cecilia and everyone.
Could you introduce yourself to the ISSIP community?
Yes, I'd be happy to. I'm Marietta Baba. I have two roles. I'm the executive director of a nonprofit called the Foundation for Women and Children Enslaved in War, also known as WCEW. And I'm professor and dean emeritus at Michigan State University. And in my professor role, I'm an organizational anthropologist, which is a subfield that tries to understand organizations in their cultural context.
Amazing, great. I know that you've been doing a lot of interesting work around social innovation as well as service innovation in general. Would you like to share any interesting latest work around service innovation?
Yes, it's related to the nonprofit that I work with. Um, we're very focused on supporting service organizations that provide direct services to people who've experienced human trafficking. And in that work, our focus is what works for survivors, what's an effective service. So we've been looking very closely through the research-based literature and also through our own research in the field at what works. And we find out that there are a lot of great services being offered because survivors face a lot of trauma and they need services to recover
Definitely,
once they've escaped or been released.
definitely.
And so a lot of great services are being offered all across the spectrum: medical, psychological, legal, educational, a whole range of services. But we don't know what works. We know that the services are described, their delivery models are
Right.
described, the number of clients that are receiving them are described.
Sure.
But what happens to the survivor over the 3 months, 6 months, 12 months after they receive a service? We don't know.
So does it mean that those service providers are not measuring the impact after they rolled out the services?
We don't measure.
Okay.
I'm
Is there
saying
any
this
reason?
generally.
Is there any reason for that?
Yes, there are barriers to measurement. So, in the first place, the sponsors of these services often don't require outcome measures. They allow process measures so you can tell how many people you've served and what kind of services you gave them, but they don't require tracking of survivors. And even if and there's a little bit of tracking, but when an organization tracks the outcome, there's no agreement on the outcome measures.
Mm.
So we found a handful of research-based papers on outcomes. They all use different measures. So it's very difficult to compare or to come to any conclusion.
Yeah.
And then there's data inconsistencies. I'm sure you can imagine that the
Okay.
baselines may not have matched, or they were hidden by the agency.
Sure.
So there's a lot of issues with that. The survivors aren't included in developing the evaluation. So we don't know if the outcomes matter to them.
Yeah, certainly. Yeah.
The service organizations don't have the resources to do the kind of work we're talking about right now. So they don't have the staff or the time. It's very time consuming and labor intensive to track survivors. So the resources aren't there. And then finally, there might be disincentives like risk aversity. So
Mhm.
for example, if you did the research and found out the service wasn't working, what then? If you didn't have the full support of your board, your staff, your community, there could be real problems if you do research and find out your service isn't working. So there's a whole host of barriers
Definitely. Yeah.
to
That's
getting this done.
sure. In terms of like the variations in data and then also the approaches to measuring the impact, I'm curious to hear if there are any kind of the initiatives that are led by the intergovernmental organization like UNHCR or other organizations.
It's an excellent question. There are efforts underway, in fact, efforts being sponsored by the US government
Oh, I
to
see.
do this evaluation of outcomes. But, however, there's a caveat. Most of those, or almost all of them, are focused on the US work on anti-trafficking in other countries.
Mm,
They aren't focused on anti-trafficking in the United States. And there's almost no funding for that.
I see.
I'm not exactly sure why.
Yeah,
So yes, it's a two-edged sword. Yes, we are learning about how to do it in other countries. No, we're not applying it in this country.
I see. I see. And also, I would love to learn more, but it's just out of my personal curiosity. Like, are there any victim supports? I mean, is there any way that we can leverage technologies or the power of innovation to provide better support to the victims of human trafficking?
Okay, great question. And yes, technology is being used to provide support, although it's not as powerful a tool as using technology by traffickers to facilitate
Exactly.
trafficking.
Right. Yeah.
So for example, there's an article out about something called MHealth,
Yeah.
which is an app that allows a survivor to discreetly reach out to a healthcare provider,
Mhm.
to schedule an appointment, or to receive a test result. And that's a great technological innovation. But at the same time, we do not have apps or technology that allow the service provider to proactively reach out to the survivor and do a check-in, discreetly and say, how are you doing? Do you need anything? We don't have that other side.
I see. I see. So MHealth is one of the great examples that are used right now, but then it doesn't make it, it sounds like it hasn't yet made, significant impact on victims' lives.
I haven't seen the outcomes,
Yeah.
research from that really.
I see. I mean, because when it comes to MHealth, because I've seen the tremendous effect that it has made in sub-Saharan Africa and other underdeveloped world in terms of healthcare service delivery model. But then probably when it comes to victim support, maybe still there are a lot of limitations, I guess.
That's where some development could really take place, is with how we can provide apps, for example, that allow victims to reach
Sure.
out when they need something and
Right.
services to reach out to see what's happening with outcomes.
What about in terms of digital literacy? Because a lot of like the women who are the victims of human trafficking, I'm not too sure if they're digitally literate or like how are they coping with that? Are they well versed in digital technologies?
Great question. And the answer is, I can say from the literature, the research literature,
Right.
yes. They are proactively using technology to get independence from pimps,
Oh, wow.
to go into the sex trade on their own using
Oh,
technology
wow.
platforms. They're
Surprising.
also saying in research studies that they want these apps, that they want to be able to have their own communities. They want to be able to do interesting and fun things. Um,
I see.
Technology is so prominent.
Exactly. Definitely.
Uh,
Yeah. And also just moving to the next question. Like there are a lot of buzzwords around tech for good these days. As the leader and thought leader in social innovation space, do you see any gaps in, how technology can be leveraged for human trafficking or social good in general?
yes. In addition to what we just talked about with survivors, there's also the law enforcement community.
Mhm.
And there are papers published about the socio-technical needs of the law enforcement community.
Sure.
And one major need is systems integration. So law enforcement uses many tools to identify victims, develop cases, investigate. There are all kinds of search tools, databases,
Interesting.
information bases, but they can't integrate these. So different departments, different jurisdictions, different levels have tools that are multivarious.
Yeah, yeah, makes sense.
How could system integration be applied in this domain so that law enforcement can see patterns and build larger cases that are more powerful?
Right. Definitely, definitely. It completely makes sense. All right. Before we close the call, I have one more question. Because you're an anthropologist, and if we are trying to leverage technology to make positive impact on victims' life, how we can also humanize these technological solutions for them? Because at the end of the day, human touch matters a lot, especially for the support for the victims of human trafficking. How we can humanize these, a lot of like emerging technical solutions for these victims.
Crucial question. And as an anthropologist, my response would be, we need to centrally involve the voices of the survivors and the people that work with them in the communities
Okay.
in a partnership, a development partnership, to design and implement the technology.
Completely makes sense. Absolutely. Yeah. Thank you so much for your time today. Before we close the call, do you have any suggestions to the ISSIP community and to the ISSIP leadership in general?
Well, if there's anybody else in ISSIP interested in this kind of work, I'd be really happy to know about it. And maybe we could talk further about, for example, developing a workshop or something on the question of technological development for the human trafficking field.
Amazing. Thank you, Marietta, for joining us today. And thanks everyone for tuning in. Thank you.
It's been great talking to you. Thank you, Cecilia.